just because you have not seen somebody die or know somebody who has died from asthma does not mean that people don't die from asthma. A fact that should wake us up is that South Africa currently ranks number 5 in the world from asthma deaths. So this shows that many people are still dying from asthma right here in South Africa. And part of this is due to the over-reliance on the blue or the short-acting beta agonist inhaler, the one that gives quick relief. So yes, people do die from asthma. So the way we manage asthma in South Africa is via a maintenance treatment which contains an anti-inflammatory molecule which controls your asthma, and then a blue short-acting reliever pump which gives rapid and temporary relief of symptoms. And in patients' minds, this works very well, and because it gives quick relief, patients tend to use it more often. And so yes, it does lead to over-reliance on certain medication. So with asthma and COVID-19, as we know, COVID-19 is a respiratory illness, and it can affect your upper respiratory tract as well as your lower respiratory tract, which means that we are all vulnerable to COVID-19 infection. However, the good news as far as asthma is concerned is that if one's asthma is well controlled and you're using your medication correctly, there is no greater chance of you landing up in hospital compared to somebody who does not have asthma. So in short, asthma does not put you at increased risk of dying because of asthma from COVID-19. So this myth can be both true and untrue in the sense, and let me give you an example. So in my practice, whenever I encourage my patients and the parents to use the asthma medication, parents will often say, "Doctor, I don't want to use it too much because I don't want my child to become dependent on it." And this is not true. You cannot become dependent on the medication. You need the medication to control your asthma and to prevent asthma attacks. The problem comes in is that we tend to overuse the short-acting blue inhaler merely because it gives quick relief. And then we tend to neglect the maintenance therapy, the one that we should be using every day. So in short, it is not habit-forming. The medications are not dangerous provided they are used correctly. So we want to discourage using the blue inhaler every day and rather use the maintenance controller therapy every day. Unfortunately, asthma cannot be cured, but asthma is highly treatable and controllable provided the medication is used correctly. It is used incorrectly when we are over-reliant on the short-acting beta agonist or reliever medication. And it is used correctly or controlled correctly when we use the maintenance therapy every day to control your asthma. A good place to start is to do a simple test to see if you are over-reliant on the blue inhaler, and there is a test to determine this.
If you live with asthma, it's important to know if you're over-reliant on your blue inhaler. Just take the Reliever Reliant test here at www.rateyourreliance.com. Answer the 5 short questions, and based on your responses, the test provides you with a score indicating if you're high, medium, or low risk of over-relying on your SABA blue reliever inhaler. Your evidence-based results are immediate, and the score categories and feedback will alert you if you're over-reliant. Download the results via the digital tool and use them to discuss your asthma control with your healthcare professional as soon as possible.
So if the test determines that one is over-reliant on the short-acting or the blue inhaler, please share this information with your doctor or your nurse or the pharmacist, but don't stop taking any medication. Let them guide you in terms of the way forward to manage your asthma better. The key message that we need to leave with everybody is that we need to separate fact from fiction or fact from myths. Information needs to be shared with our healthcare providers. We need to determine if you are over-reliant on your blue inhaler so that we can manage your asthma correctly. And therefore, use this knowledge because knowledge is power.